You've just woken up, maybe in the middle of the night, and there it is again. That strange, prickly, pins and needles feeling in your hands. Or perhaps you're simply enjoying a quiet afternoon, reading a book, when a numbing sensation creeps into your fingers, slowly spreading until your hands feel less like your own. It's unsettling. Isn't it this tingling? This pins and needles? This occasional numbness in your hands after 60, it's a surprisingly common experience. And for many, it brings a quiet worry. You might wonder if it's just a sign of getting older, something to simply accept, or if it's trying to tell you something more. The truth is, while it can be benign, it can also be a little whisper from your body, urging you to pay attention. Ignoring these sensations can sometimes mean missing an opportunity to address something important early on, something that could impact your comfort and quality of life. But here's the surprising secret: understanding what these sensations might mean can put you back in control. In this video, we're going to gently explore the most common reasons why your hands might be tingling, what steps you can take to find relief, and when it's truly time to have a chat with your doctor. Watch to the end for something that will surprise you about managing these symptoms and living your best life. Let's dive right into the first common culprit that often sends those tingling messages up your arms and into your hands: nerve compression. Imagine your nerves as delicate electrical wires running from your brain and spinal cord, stretching all the way to your fingertips. Just like a wire can get pinched, so can a nerve. One of the most well-known examples of this is carpal tunnel syndrome. This happens when the median nerve, which runs through a narrow passageway in your wrist called the carpal tunnel, becomes compressed. Think of it like a tight sleeve around your arm. When that sleeve is too tight, it squeezes what's inside, in the wrist. Things like repetitive hand motions, wrist position, or even swelling can cause that pressure. You might notice the tingling or numbness mostly in your thumb, index, middle, and half of your ring finger, often worse at night, sometimes waking you up. You might even feel like you need to shake your hands out to get the feeling back. It's a very common complaint, especially as we age and our tendons might become less pliable or swell more easily. The good news is, there are practical things you can do. Simple wrist splints, particularly worn at night, can keep your wrist in a neutral position and relieve pressure. Paying attention to your posture, ensuring your wrists aren't bent awkwardly when using a computer or doing daily tasks, can make a real difference. Gentle hand and wrist exercises, designed to keep the tendons gliding smoothly, can also be quite beneficial. Many people find relief just by making these small adjustments. But it's not just the wrist that can cause nerve compression. Sometimes the problem originates higher up, perhaps in your elbow, a condition often called cubital tunnel syndrome. This occurs when the ulnar nerve, often referred to as your funny bone nerve, gets compressed, usually where it passes through a narrow tunnel on the inside of your elbow. If you've ever hit your funny bone and felt that jolt and tingling down your arm to your little finger and ring finger, you know exactly what this feels like. Persistent pressure on the elbow, like resting your arm on a hard surface for long periods, or even bending your elbow too much during sleep, can aggravate this nerve. Being mindful of how you rest your arms, perhaps using a pillow to keep your arm extended at night, can help immensely. Then there's something called radiculopathy, which sounds a bit fancy, but it simply means a nerve is pinched where it exits your spinal cord, often in your neck. This is where those wires originate. Remember, if you have issues like degenerative disc disease, arthritis in the spine, or even a bulging disc in your neck, it can put pressure on the nerves as they branch out to your arms and hands. The tingling here might be accompanied by neck pain, stiffness, or even weakness in your arm or hand, and it can affect different fingers depending on which specific nerve is compressed. Good posture, gentle neck stretches, and physical therapy are often key approaches here. Knowing which fingers are affected can give your doctor a real clue as to which nerve might be the culprit. It's always worth mentioning these patterns to your healthcare provider, as they can help pinpoint the exact location of the compression and suggest the most effective path forward. These are often mechanical issues, meaning something is physically pressing on the nerve, and with the right adjustments and care, many people find significant relief and can reduce or even eliminate that bothersome tingling. Now that we've discussed how nerves can get pinched, let's move on to another crucial area that often gets overlooked when we talk about tingling hands, and it's something you might be able to influence with what's on your plate. Beyond those physical pinches, another significant reason for tingling hands, especially as we get older, can come down to something as fundamental as what you're putting into your body. Or rather, what might be missing. We're talking about nutritional deficiencies, and specifically, a lack of vitamin B12. This humble vitamin plays a huge role in keeping your nerves healthy. Think of it as the insulation around those nerve wires we talked about earlier. Without enough B12, that insulation can start to fray, leading to nerve damage and, you guessed it, tingling, numbness, and even weakness, often starting in the hands and feet. The interesting thing about B12 deficiency is that it becomes more common after 60, not necessarily because older adults don't eat enough B12-rich foods, but because our bodies can have trouble absorbing it. As we age, our stomach acid production can decrease, and stomach acid is vital for separating B12 from the proteins in food, so our bodies can use it. Certain medications, like those for heartburn or diabetes, can also interfere with B12 absorption. So, how do you make sure you're getting enough of this vital nutrient? B12 is found primarily in animal products. Think lean meats like beef and chicken, fish, eggs, and dairy products like milk and yogurt. If you're vegetarian or vegan, it's particularly important to be mindful of your B12 intake. Fortified foods, like some breakfast cereals or plant-based milks, can be a good source, but a B12 supplement might be necessary to ensure you're getting enough. Even if you eat animal products regularly, it's wise to discuss B12 levels with your doctor, especially if you're experiencing persistent tingling. A simple blood test can reveal if your levels are low, and if they are, your doctor can recommend the right dosage for a supplement, or in some cases, B12 injections. It's amazing how much difference simply addressing a vitamin deficiency can make to overall nerve health, and how quickly those tingling sensations can improve once your B12 levels are back on track. It's a relatively simple fix for what can be a very uncomfortable symptom, and it's a perfect example of how paying attention to your body's needs can have a big impact. Now, while we're on the topic of nerve health, let's broaden our scope a little because tingling hands can also be a sign of something called peripheral neuropathy. This is a more general term that means damage to the peripheral nerves, which are all the nerves outside of your brain and spinal cord. It's a very common cause of tingling and numbness, and unlike the nerve compression we talked about earlier, it's not always about a physical pinch. Often, peripheral neuropathy is a symptom of another underlying health condition that affects nerve health more broadly. The most common underlying cause by far, especially for those over 60, is diabetes. High blood sugar levels, over time, can severely damage nerves throughout your body, leading to diabetic neuropathy. This typically starts in the longest nerves first, which means you'll often feel the tingling, numbness, burning, or even sharp pain in your feet first. But it can absolutely progress to your hands. The damage isn't usually caused by a sudden event, but by the cumulative effect of blood sugar fluctuations. This is why managing blood sugar levels is absolutely critical for anyone with diabetes. Simple steps like following a balanced diet, limiting sugary foods and refined carbohydrates, staying active with regular walks, and taking prescribed medications are not just about managing diabetes. They are about protecting your nerves from further damage and preventing or slowing the progression of neuropathy. It's about taking proactive steps to maintain the health of those delicate nerve pathways. Beyond diabetes, other things can contribute to peripheral neuropathy. Excessive alcohol consumption, for instance, can be toxic to nerves over time. Certain autoimmune diseases, like lupus or rheumatoid arthritis, where the body's immune system mistakenly attacks its own tissues, can also damage nerves. Even some infections, like shingles, can cause nerve inflammation and damage leading to persistent tingling, even after the rash has cleared. The key takeaway here is that if you're experiencing tingling and numbness, and it doesn't seem to be a simple nerve pinch, it's crucial to explore these potential underlying causes with your doctor. Getting a diagnosis and managing the root cause is the most effective way to address peripheral neuropathy. It often involves a thorough look at your overall health, including blood tests and discussions about your lifestyle. Moving on from nerve health, let's consider another vital system that can impact the feeling in your hands: your circulation. When your hands tingle, it might not always be about the nerves themselves, but about whether they're getting enough blood flow. Think about it. Your nerves, just like every other cell in your body, need a constant supply of oxygen and nutrients delivered by your blood. If that supply is hampered, your hands might start to complain with a tingling sensation. One condition that can affect blood flow to your extremities is peripheral artery disease, or PAD. This occurs when arteries outside of your heart and brain narrow, usually due to a buildup of plaque, restricting blood flow to your limbs, most commonly your legs, but it can also affect your arms and hands. If your hands feel cold, look pale or bluish, or experience tingling that worsens with activity and improves with rest, PAD could be a consideration. It's often a sign of wider circulatory issues, and risk factors include smoking, diabetes, high blood pressure, and high cholesterol. The good news is that lifestyle changes can make a big difference here. Quitting smoking is paramount, as is regular exercise, even gentle walking, which can help improve circulation over time. Eating a heart-healthy diet, rich in fruits, vegetables, and whole grains, and managing existing conditions like high blood pressure and diabetes are all crucial steps in improving blood flow and keeping your hands happy. Another condition related to circulation is Raynaud's phenomenon. This is when the small arteries that supply blood to your skin narrow, often in response to cold temperatures or stress. Your fingers might turn white, then blue, and then red, often accompanied by numbness, tingling, or throbbing. It can be quite startling to witness. While it's often a primary condition, meaning it's not linked to an underlying disease, it can sometimes be a symptom of a more serious autoimmune condition. Keeping your hands warm is the simplest way to manage Raynaud's. Wearing gloves or mittens, even indoors if you're prone to it, and avoiding sudden temperature changes can help prevent attacks. For some, specific medications might be prescribed to help widen the blood vessels. The common thread here, whether it's PAD or Raynaud's, is the importance of healthy blood flow. Your circulatory system is your body's highway, and if there are traffic jams or detours, every part of you can feel it, including your hands. It highlights just how interconnected our body systems are, and how addressing one area, like heart health, can positively impact seemingly unrelated symptoms like tingling hands. Next, we'll dive into some other surprising contributors to those tingling sensations, including something you might be taking every day without realizing the potential side effects. Now, while those are some of the most frequent reasons why your hands might be tingling, there are a few other possibilities that are important to be aware of. Sometimes, the cause might be a little less obvious, but no less significant for your comfort and well-being. Let's consider your thyroid gland. This small, butterfly-shaped gland in your neck plays a huge role in regulating your metabolism, energy levels, and even nerve function. If your thyroid isn't producing enough hormones, a condition known as hypothyroidism, it can lead to a whole host of symptoms, including, you guessed it, tingling and numbness in your hands and feet. This is because a sluggish thyroid can cause fluid retention, which might put pressure on nerves, or it can directly affect nerve signals. Other signs of an underactive thyroid might include feeling constantly tired, gaining weight unexpectedly, feeling unusually cold, or experiencing dry skin and hair. If these symptoms sound familiar, especially when combined with tingling hands, it's definitely worth a conversation with your doctor. A simple blood test can check your thyroid hormone levels. And if they're off, medication to restore your thyroid function can often resolve these types of nerve symptoms, along with improving your overall energy and well-being. Another often overlooked culprit can be right in your medicine cabinet. Certain medications, while crucial for managing other health conditions, can sometimes have side effects that include tingling or numbness, a phenomenon called medication-induced neuropathy. Drugs used for chemotherapy, some antibiotics, certain blood pressure medications, or even some cholesterol-lowering drugs can, in a small percentage of people, cause these nerve-related symptoms. It's never a reason to stop taking a prescribed medication on your own, but it is absolutely a reason to discuss your symptoms with your doctor. They might be able to adjust your dosage, switch you to an alternative medication, or offer strategies to manage the side effect. Your doctor is the best person to weigh the benefits of your medication against any side effects, and open communication is key to finding the best solution for you. Finally, while less common, it's important to briefly touch upon a couple of more acute or serious causes of tingling hands, primarily for awareness. If tingling or numbness comes on suddenly and is accompanied by other symptoms like weakness on one side of your body, difficulty speaking, or a sudden severe headache, it could be a sign of a stroke or a transient ischemic attack, often called a TIA. These are medical emergencies that require immediate attention. Remember the acronym fast face drooping, arm weakness, speech difficulty. Time to call emergency services. While this is far less likely to be the cause of ongoing, gradual tingling, it's vital to know when a symptom warrants immediate medical care. Another less common but distinct cause of tingling can be the aftermath of shingles. If you've had shingles, even after the rash has cleared, some people can experience persistent nerve pain, burning, or tingling in the affected area, known as post-herpetic neuralgia. This is a direct result of the nerve damage caused by the virus. So, as we've explored, the tingling in your hands after 60 isn't just one thing. It could be a simple nerve pinch like carpal tunnel syndrome, easily managed with some ergonomic adjustments. It might be a sign of a nutritional need, like low vitamin B12, which can be quickly remedied with supplements. It could be a signal from your body about broader health conditions like diabetes or circulatory issues, highlighting the importance of managing those underlying conditions. Or it could be related to your thyroid, or even a side effect of medication. The main takeaway here is this: those tingling sensations are your body's way of communicating. They're not something to ignore or simply dismiss as just getting older. Instead, view them as an opportunity to check in with your health, to understand what's going on, and to take proactive steps. Remember, small changes in how you move, what you eat, or a simple conversation with your doctor about your symptoms and medications can make a truly big difference to your comfort and happiness. Don't hesitate to reach out to your healthcare provider. Explain your symptoms clearly, and let them help you uncover the cause and guide you towards the right solutions. You are the expert on your own body, and your doctor is your partner in health. We truly hope this video has given you a clearer picture and some actionable insights. If you found this helpful, please give us a thumbs up and share your own experiences or questions in the comments below. We love hearing from you. And if you want more helpful content to live your healthiest, happiest life at every age, subscribe to our channel and hit that notification bell so you don't miss a thing. Keep listening to your body, keep asking questions, and keep living your best life at every age.